COVID is not just a seasonal virus, that it's showing itself to be a year-round phenomenon. Carol Williams, our first Community Health Network nurse, said, "So you mean that COVID isn't finished with us yet?" It's exactly the point. We need to figure this out in realistic terms, and I think the FDA is making sense when they talk about making COVID vaccination an annual vaccination at the time of flu vaccine. To do them both together begins to normalize COVID vaccination, because up to now, we need to be honest here, is I don't think the messaging has been all that clear or consistent. It gives people the impression of the yo-yo phenomenon. One example of that is what is happening with masking in healthcare. And starting February 12th, the state health department discontinued or let the mandate for masking in healthcare settings expire. What wasn't clear in letting this mandate expire was that the health department expected hospital systems, clinics, community health centers like Trillium to make their own decisions about masking based on what the CDC calls sort of local disease transmission. And all of New York State is still considered high transmission. So according to CDC, localities need to make the decision to continue masking. And there was an interesting press conference with Dr. Mike Mendoza, our director of Monroe County Director of Public Health, Commissioner of Public Health, and Mike Apostolakis, the Chief Medical Officer of University of Rochester, and Dr. Rob Mayo, the Chief Medical Officer of Rochester Regional Health. And they all agreed that for now, masking would continue at Trillium. We're still doing it, and I think we need to. We haven't seen a lot of pushback, and people really are making an effort to stay masked, wear the mask over your nose and mouth, wear it correctly. What's past is prologue. In other words, learn from history. Take the things that you learn that work and apply them here. And a mask is a condom for your face. COVID is really endemic now, meaning it's here. So the best way to keep it under control is to stay current, up to date with vaccines and boosters. At the end of the day, we're trying to slow virus spread, stop virus spread, prevent people from getting sick and getting rid of this, or at least controlling it better. Because I still see sick patients with new infections. And I think we can do better.